Hey, my name is Emmanuel with Sandstone Care, and today I'm going to talk to you about the pros and the cons of outpatient treatment. When you're considering treatment options, everything can feel new, and a load of information can sometimes become overwhelming. So whether you've heard of outpatient treatment before or not, today I want to help you navigate the pros and the cons of outpatient treatment so you can better understand outpatient programs and have a better understanding of whether or not it may be beneficial for you or a loved one. Quick note before we get started, outpatient treatment programs may not be the perfect fit for everyone at first, but it is a very important part for long-term recovery. At Sandstone Care, we do offer support for teens and young adults with mental health and substance use disorders, so if you do find this video helpful, at the end I'll be sharing resources on how you can get connected. Let's jump into it. So what exactly is outpatient treatment? Outpatient treatment programs offer individuals a place to receive care and support while continuing their own lives. In outpatient treatment, a young person doesn't have to be entirely isolated from their own daily lives and communities while getting the help that they need. Outpatient treatment offers structure and support while also allowing for a bit of flexibility. Now, this is a level of care that some may start out on if they're recovering from a moderate addiction or mental health disorder, and it can also be a level of care that a person moves down to if they recently completed inpatient treatment or a residential treatment program. For teens and young adults who may still have school, work, or other responsibilities that they want to continue while receiving treatment, outpatient care would be a great fit. Ultimately, when you're considering treatment options, it is so important to research and talk to a professional to get guidance and support. Now, let's talk about the pros of outpatient substance abuse programs. For a lot of individuals, going to an inpatient treatment program or a residential treatment center can be quite a tough adjustment to make. And at the end of the day, it may not be the most beneficial option either. Again, outpatient treatment programs allow for flexibility. A person can stay in school, keep their job, and maintain supportive relationships. Another big plus of outpatient programs is the cost. Now, outpatient programs tend to be more affordable than inpatient treatment programs and are more likely to be covered by insurance. The structure of outpatient treatment also promotes longevity and stability, and it makes it easier to transition to different levels of care. Another pro is that outpatient treatment also helps to build community. It provides an open space where meaningful relationships can build and grow and be maintained together. So what are some of the downsides of outpatient care? One is the lack of medical detox. If a person requires detoxification from substances, they may need to start at a higher level of care for their own safety and proper management of their withdrawal symptoms. Outpatient care may not be suitable for individuals who would benefit from 24-hour supervision and could pose a danger to themselves or others without it. Again, in this case, you may want to consider a higher level of care. Additionally, outpatient treatment requires family involvement. Good outpatient programs work with the whole entire family system, and sometimes the family is not as involved or as supportive as we wish them to be. Outpatient programs require work and are most effective when the person has a strong support system behind them. And outpatient programs may not be the best fit for everyone right away. However, it is an important step, again, for long-term success. At Sandstone Care, we offer age-specific, individualized treatment for teens and young adults with mental health and substance use disorders. Now, there are a variety of different treatment options that are catered for each individual. Our partial hospitalization program, which is also known as day treatment or PHP, is the most intensive level of outpatient treatment. Day treatment may be suitable for young people who are not currently in school or they're finishing school online. And it usually takes place during the day, 5 days a week, with 25 hours of weekly programming. Our intensive outpatient treatment, often referred to as IOP, is a longer-term program that lasts 8 to 12 weeks. IOP allows for a lot of flexibility for teens and young adults who may still be attending school or have a job or have other responsibilities that they want to keep up with while still receiving treatment. The last treatment option I'm going to talk about here that we offer is general outpatient treatment. General outpatient treatment is considered a stepping stone from IOP to a less intensive service. With general outpatient care, participants can live at home in recovery living or on their own and travel to a facility or office to receive the care that they need. General outpatient treatment is typically around 12 weeks and focuses on maintaining a healthy lifestyle, integrating life skills, and most importantly, preventing future relapses. You've just heard the pros and cons of outpatient treatment and some of the resources we offer in case you need help. Now, before going, if you do want to get connected right now or talk to a live Sandstone Care member, you can contact us at sandstonecare.com or call us using the number you see right down below. Finding the right outpatient treatment program can be challenging, but if you choose to call us, we will help you find the right program for you, even if it's not with us. We care more about finding the right resource that you need so that way you can get the help that you're looking for.